Good morning, everyone, and welcome to the 2025 Living with Melanoma Patient Symposium, hosted by AIM at Melanoma and UT Southwestern Medical Center. My name is Dr. Daniel Wang. I'm a medical oncologist here at UT Southwestern and co-lead our melanoma program. So this is actually our first symposium at UT Southwestern, and we're very delighted to have AIM at Melanoma provide such a platform for us to engage with our patients and caregivers from the Dallas-Fort Worth area, as well as the hundreds of other participants that are joining us online all over the world. First, I'd like to thank a few people. So this event wouldn't have happened without the help of AIM at Melanoma, especially Ann Garst and her team to help us bring this event live in Dallas. I'd also like to thank our team here at UT Southwestern, including Tiffany Bradshaw and Jada Johnson, who helped lead the charge here. And just for some housekeeping, there are many of you guys online. If you are joining us today via Zoom, please place your questions in the Q&A tab, which is going to be located at the bottom of your screen. And for those of you joining us on AIM at Melanoma's Facebook and YouTube live platforms, if you don't mind putting your questions into the comment sections, and we'll have a member of our team transfer them to Zoom. So it's truly an honor for us to be here and have you here as well, to come together to learn about the advancements that we've made with melanoma care. Whether you're a patient or a caregiver or even a healthcare provider, we're hoping that today's event will be sort of a beacon of knowledge and hope for those of you with this daunting disease. We know that melanoma is a deadly diagnosis, but it's really important that we remember that every step we take in understanding the disease will help us get closer to better treatments and ultimately to a cure. A little over 2 decades ago, when AIM at Melanoma was founded, advanced melanoma was considered a death sentence. But now with the advent of new therapies like immune checkpoint inhibitors and targeted therapies, we're seeing patients that are still doing well 5 years and even 10 years from their diagnosis. So this has really radically changed our view of the disease. But the reality is that half of our patients don't benefit from these treatments, so we still need to make huge strides to bring this benefit to all of our patients. We also know that many of our patients also don't have advanced melanoma. So today you're going to hear from some of our experts from the field on the latest melanoma research, from treatment options to how to manage the challenges that you may experience as you're going through your journey with melanoma, starting from diagnosis, surgery, systemic therapy, and also the side effects that you may experience with these types of therapies. We'll also touch upon a rare type of melanoma that hasn't seen as many of the benefits as we've received for cutaneous melanoma. And we're very lucky to have Dr. Johnson from Vanderbilt University joining us today virtually to give his expert perspective on immunotherapy and their toxicities. Now, we do understand that every one of you has had a unique journey, and we encourage you to ask questions during the Q&A session and engage in discussion and hopefully connect with fellow patients and caregivers and some of the health providers that you've worked with to discuss some of the experiences that you've had. We're hoping by coming together, we can sort of empower ourselves with knowledge and also create a network of strength and hope. Finally, I'd like to thank you all for being here today, and we're really excited to share what we've learned. And we hope that today's symposium leaves you feeling more informed, supported, and hopeful about the path forward. So with that, let's get started.